Everyone, so we're going to do last chapter of illustrated textbook of pediatrics, which is global child health. Features of global child health: great progress has been made in improving the survival of children and young people less than 15 years globally over the last 3 decades. There are wide regional, inter-country, and intra-country disparities in mortality rates, poverty, poor mental education, conflict, and nutrition, inadequate access to safe water, food, sanitation, healthcare are the main causes of child mortality. The number of children dying from infectious diseases has spiked markedly. Living mortality accounts for increasing proportion of childless and could be markedly reduced by the basic immunity. Child mortality has been remarkably reduction in the number of deaths globally among children and young children less than 15 years since 1990, with a 56 reduction from 18.2 million to 6.2 million in 2018. Of these child deaths, 85% were children under 5 years. Maternal mortality first 4 weeks accounts for 47% of all under 5 deaths to 25 million. Infectious diseases are an important cause of under 5 mortality. Pneumonia, diarrhea, malaria account for nearly a third of under 5 deaths. And then nutrition is also a contributing factor to over 1/3 of child's death where death occurs. Although only about 2% was identified in sub-Saharan Africa and Central West Asia, more than 80% child deaths occur in these two regions. Over half of all child deaths occur in just 5 countries: India, Nigeria, Democratic Republic of Congo, Pakistan, and Ethiopia. Mortality rates are the useful measure of the quality of child health outcomes between regions and countries. For example, lesson 5 here, mortality is sub-Saharan nature, which is reminds you mortality between different countries of the world is shown. All 6 countries with an unemployment mortality rate above 100 deaths per 1,000 livelihoods in sub-Saharan Africa. This means the risk of dying before the birthday of a child born in one of these countries. Sierra Leone with a mortality rate of 105,000 livelihoods, about 7 times higher than the lowest mortality country. Combining child mortality rates and health outcomes in different countries in order to determine child mortality health outcomes, monitor change, accurate data need to be collected. There has been considerable efforts to improve data collection, but many obstacles remain. Even deaths, particularly of newborn infants, are often unreported in countries with poor welfare administration. These are mortality rates. Sub-Saharan UK differences. Dates of children is less than 25 years. This is all the regions that's in children, which is discussed, which is why is child mortality so high? Children depend on their environment as well as position of healthcare for its survival. Described in chapter 1, environment can have major detrimental effects on their chances of survival, poverty, and social detriments. Pervade almost all aspects of health and healthcare in almost all low resource countries. There's a marked difference in health outcomes between high income and low income groups. And maternal education, the higher the level of maternal education, the higher the chance of a child survival. Poor sanitation and clean water, increase in diarrhea infections, poor food security, malnutrition, increased vulnerability and severity of illness, respiratory infections, and chronic malnutrition is inflicting and stunting of children, inadequate housing, air pollution, and urban overcrowding promotes the spread of respiratory pathogens. Context C, the children affected by context section. Geographical variation in diseases, large intercountry and inter-region differences. Children under 5 years accounted for 61% of malaria deaths worldwide in 2017, but the rate was much higher in sub-Saharan Africa compared with Southeast Asia, WHO 2018. Provision of healthcare in many low and middle income countries were adversely affects survival, limited finance available for healthcare, whereas Sweden spends $200 per year on health. 11% was domestic product in 34 low resource countries, which is less than 50 per person per year, WHO 2016. Disease prevention, vaccination, insecticides needed, net distribution production for malaria, lower coverage in poor areas of country and conflict. Access may be difficult to get to health facilities, increased cost, and therefore affordability may be major limiting factors. Community care, limited by lack of trained community health workers, health centers and hospitals can compromise by lack of trained healthcare professionals, equipment, drugs, suitable buildings, etc. Medical care, lack of trained doctors, a serious problem in almost all these countries. The contrast between proportion of doctors compared with deaths in children is shown in Charity size should be used of all decision at age 1 to 5 years. And presentation should be used of doctors' messages will work with that age. And reducing childhood. There has been a major effect by many low and middle countries to reduce childhood. This has been done in conjunction with the international community's programs of aid, United States Agency for International Development, USAID, the government of USAID, Charities, Gates Foundation, and non-government organizations, UNICEF, Save the Children, etc. Some of the major international initiatives are listed. The publications of integrated management, childhood, and CI in 1980 was an important step in promoting a comprehensive and holistic management of children attending primary and secondary health facilities. It recognized that an integrated approach to childhood illness is required, including nutrition and preventative care in families and communities. In health facilities, sick children are triaged according to the prevalence of specific danger signs, and management is planned according to algorithms. A major advance in global child health was the adoption of the Millennium Developmental Goals, which has served as a focus for the international communities. The movement to reduce child mortality, specific target for MPG 4 was to reduce child mortality in children of 5 years old by the hospital in the years 1990 and 2015. 1990, there were 12.7 million births of children under 5 years of age compared with the 5.9 million in 2015. Full reduction reduction contributions were also made by other MPGs, which included reducing maternal mortality, MPD5, and reducing burden of HIV, and tuberculosis, MPG6. Progress in improving global child has continued and accelerated further with the adoption of sustainable development. Sustainable development goals were approved by all 93 UN member states in 2015. The 8 MDGs in Millennium Development Goals were replaced with 17 Sustainable Development Goals, which have broad association. One Sustainable Development Goals really focus on health and ensure healthy lives and promote well-being for all at all ages. This includes any preventable deaths, newborn children under 5, and sets a target mortality rate of less than 12 per 1,000 live births for neonatal mortality and less than 25 for children aged under 5 years by 2030. In addition, other SDGs with relevance to health are focused on ending poverty and hunger, combating climate change, and improving education. Example of how SDGs may overlap school-based programs which include school feeding, micronutrient supplementation, treatment of soil, cosmetic helmets, protection from malaria, and improved water sanitation and hygiene. Whilst many countries have already achieved child health mortality targets set out in the SDGs, 121 out of 195 countries, and a number more are on target to do so by 2030. 21 countries, 53 countries, 2/3 of which are Sub-Saharan Africa are projected to fail to achieve the targets measured. Additional support will be required to avoid this from happening. Sustainable development goals, no poverty, zero hunger, good health and well-being, and quality education, gender equality, clean water and sanitation, and affordable and clean energy, decent work, and economic growth. These are the industry innovation infrastructure, reduce inequality, sustainable cities and communities, responsible consumption production, and the climate action, life below water, life on land, restructuring strong institutions, partnership for the goals, and maternal and key international purpose in 1946. The United Nations Children Emergency Fund, UNICEF established, and the World Health Organization formed 1974 extended program, EPS diphtheria, versus tetanus, and polio, TB, and measles. 1980 will be at the Fed free family higher strategy, food monitoring, orally addition therapy, breastfeeding, immunization, family spacing, female education, food supplementation. 1989, Women Commission on the Rights of Child. 1992 was Science for Children, Child to Child Strategy, Baby Friendly Initiative, Integrated Management of MCI. In 2000, UN endorses Millennium Development Goals. Global 2013 Global Action Plan for Pneumonia and Diarrhea 2015 Sustainable SDGs adopted by all UN members. And maternal health before conception, family can encourage delay of first pregnancy to age 18 years and 3 yearly birth interval. Maternal nutrition optimized, including folic acid to prevent nutrient effects, chronic conditions stabilize, habitual diabetes, infection prevention and treatment, malaria, tetanus, STIs, and HIV. Complication pregnancy managed preeclampsia labor, antenatal sterilized preterm labor, skilled birth attendant at all births with no resuscitation, trainings, and timely and skill management complications, disease, section treatment, neonatal asphyxia, and screen delivery practices. Improving neonatal survival, there were 2.4 million neonatal deaths in the first month of life in 2019. Progress in reducing neonatal mortality has been strikingly slower than in reducing under 5-year-old mortality, whereas the birth of baby should be a joy sufficient will be every year. Some 295,000 mothers die during or following pregnancy in childhood, and about third of all neonatal mortality occurs during or in the first year after birth. There are also around 2.6 million stillbirths. The main cause of neonatal death are preterm birth, intrapartum related complications, perinatal asphyxia, and infectious sepsis and pneumonia. Neonatal death is an important cause of death in many countries, though this has been markedly reduced by maternal immunization, hygiene, and delivery, especially clean cord care. Intrauterine IgR is a significant comorbidity in many neonatal deaths. Around 20 million infants are born with low birth weight, less than 2.5 kg each year. Global prevalence of 15.5, with over 95% of these in developed countries. Low birth weight contributes to 60 to 80% neonatal death. Maternal health and reproductive cares. Maternal health and reproductive care are major determinants of neonatal mortality. Factors are listed. About 70% of disease worldwide now by skilled work attendant, but their sector skills are variable. And rapid respiratory health facilities able to deal with accepted emergencies remains problematic. Participatory women's growth and mothers' need for paid counsel to deal with their local issues have been shown to not be reduce both maternal and neonatal mortality. Saving newborn lives, estimated that over 1 million newborns could be saved by provision of essential newborn care, while in some settings, provision of more advanced medical care, 18 years intensive care, including mechanical rehabilitation, may be appropriate. The lives of largest number of babies can be saved if essential neonatal care was available. Intervention, neonatal essential newborn care. Skilled birth attendants could provide basic neonatal resuscitation, helping babies speed program, identify infants needing additional care, appropriate trained healthcare professional have been leading sleep program, hospital level interventions, infection prevention, hand hygiene, clean cord cutting, ligature, chlorhexidine before, hand hygiene, clinic hypothermic prevention, drying of the baby, skin kissing contact of mother and child, and covering movements during head delay by invading the baby. If significantly preterm, placing plastic bag, wrap immediately after birth, then radiant heater or pivotal environmentals or tender molecular condition is stable. And feeding early and exclusive breastfeeding within 1 hour period. Supplemental feeding if required, express personal given via major recipe. Sick preterm, transferring infection, neonatal and antibiotic treatment, better increased risk for signs infection, supplemental oxygen, non-invasive, spinal support, intravenous fluids is required. This is a preterm baby reborn with born with a growth of 1.9 at gestation age of 32 weeks in Malawi. The mother was transferred to a district hospital to deliver her baby. After the spontaneous onset preterm labor, following delivery, the effects of 24 mild respiratory distress and antibiotics and express breast milk by nasogastric tube. Oxygen therapy was monitored with an oxygen saturation monitor after 3 days, and an incubating is nursed by Angry Mother Care, where the mother provides continuous care for baby in the chest. This provides better thermal care and lower infection rates in incubating care and promotes breastfeeding maternal bonding to her baby. Breastfeeding was successfully established in a period of 2 weeks. Improving the survival quality of life of children, nutrition and nutrition diversity. Exclusive breastfeeding for the first 6 months of life is strongly advocated by the WHO. As it is the ideal milk for babies raise less risk of gastroenteritis and other infections. The baby-friendly hospital initiative comprises 10 steps and 10 departments to promote breastfeeding, exclude any other feeds unless medically indicated. And the nutrition remains a major problem in many countries, both through the chronic malnutrition. It is estimated 52 million children under 5 years of age are wasted Low weight for height, 17 million are severely wasted and 155 million are stunted. Low height for age. Over 90% are in Africa and Asia, the majority in South Asia as well. As undernutrition, malnutrition of obesity has become an increasing problem in lower middle income countries. It has become a major global health problem globally. Over 41 million children under the age of 5 years are overweight, to over half. But over half of these live in Asia and a quarter in Africa. Being overweight above one standard deviation body mass index is 6 or obese above two standard deviation body mass index is 6 is probably seen in middle class families where energy dense food intakes are popular. Children do much less exercise than those in poorer communities. Infection and major complaint reduction in child mortality has been reduced. Mortality from infection diseases strategies adopted to reduce infection is shown. Exercise key contributors estimate to 20.3 to 3 million deaths a year during 2018. 86% infant worldwide, while 116 million received 3 doses of diphtheria, tetanus, pertussis, DPP, 3 vaccine with over 90% coverage in 129 countries. In addition, 86% children receive 1 dose of the measles vaccine, 69% 2 doses. Global measles mortality has declined by 73%. However, about 19 million children have not received even their DTP vaccine. Inadequate coverage is threatening the continuing contribution of vaccination to reduce child mortality, and there is inequity in vaccination offered in different countries, as well as in the coverage of vaccination schedule within countries. The WHO Global Vaccination Action Plan aims to ensure universal access to vaccination, but uptake has stagnated in recent years and has been further adversely affected by the global pandemic. Reasons include difficulty in delivering vaccine because of poor infrastructure and exacerbated by the need to keep access school. Major issues vaccine hesitancy, which may be fueled by the spread of misinformation about vaccine via highly connected social media networks, as well as distrust of government social systems. Decline in uptake of measles vaccine has resulted in measles outbreak in Europe and USA. Vaccine acceptance has been insufficiently wide herd immunity. Injuries, globally injuries are sponsored by the Cell. Deaths of children and young people under the age of 20 years each year. The 5 major causes of global child injuries are road traffic incidents, burns, drowning, poisoning, and falls. Road traffic injuries are responsible for around 1 into 5,000 child deaths, and 93% deaths occurring in low and middle income countries. They are the leading cause of deaths among 15 to 19-year-old. Injuries from road traffic incidents is one of the few causes of child mortality that's predicted to increase by 2030. Mortality and morbidity are exacerbated by limited access to good surgical care. We're almost done with it. Mental health disorder globally. Good surgical care. Non-communicable diseases, predominantly cancer, cardiovascular disease, chronic respiratory disease, and diabetes are markedly increased in low and middle income countries, such that they now constitute 80% global burden. 5 key risk factors are unhealthy diet predisposing to obesity, tobacco use, alcohol use, physical inactivity, and pollution, which accompany increasing affluence in low and middle income countries, and of their origins in childhood. Undernutrition in early childhood, followed by overnutrition, leads to a particular risk for subsequent cardiovascular disease and diabetes. Household air pollution from smoke in homes using solid fuels such as wood or charcoal for cooking and heating predisposes children to lower respiratory infections and asthma and prone to chronic obstructive airway disease and other NCDs. This can be prevented by use of cleaner fuels, which also helps reduce forest degradation through climate change. Mental health problems globally 10 to 20% children and adults have mental health disorders that impact negatively on their health and well-being. The epidemiology of child health and mental health is fully described, and access to services is scarce, even in the middle income countries. Suicide is a major cause of death in young persons. Just this girl in rural like sustained visual violence, and she fell into a competition fire where she had a seizure Although my epilepsy had initially responded very differently after various supplies for difficulty finding affordable transport from the village to the health clinic, the late visitation of 4 days, by which time the sickly infection will increase the cataract from the jet diet. This simple example highlighted the influence of environment on children's health. Although her illness was readily treatable and her injuries were treated preventable, the 5-hour delay treatment resulted in complication of any basic care was available at the clinic. So this is the pneumonia prevention expanded EPI, including pertussis, influenza type B. These are strategies to reduce infection. Community management, injection of severe anemia, antibiotic therapy in hospital. For hospital management, antibiotic and incision therapy. Diarrhea, water sensation, high wash. Oral rehydration therapy, ORS, and portable feeding, ORS, and IV, goods, F shop. Malnutrition, household food security, school feeding programs, dewormings, breastfeeding promotions, and zinc supplementation. Ambulatory, ambulatory management by body malnutrition with ready-to-use therapeutic food. WHO 10 steps recovery for inpatient management of severe acute malnutrition. Malaria insecticides, treated bed nets, and vectors and cellular. So, near patient rapid diagnostic testing for malaria, artemisinin combination therapy, TB effective adult TB control program, disease immunization, contact tracing, isonizing preventative, treatment effective, childhood TB case detection, access to suitable laboratory services, child-friendly TB treatment programs, HIV preventable, further to child transmission, and access to HIV surgical antibody biological inclusion testing, child-friendly ART treatment programs that will integrate management of childhood illness, UCI, and training courses, emergency triage assessment, and treatment. Children affected by conflict. This in a number of countries in the Middle East, Africa, and Southeast Asia, I mean, there are large numbers of internally displaced people and refugees. Over half of whom are under the age of 18-year-old. Children and women are disproportionately affected physically and psychologically by conflict as well as of threat threat to life. Children living in conflict may suffer in a wide variety of ways. They may lack shelter and endure exposure to harsh weather such as freezing. Extreme winters, in the lack of clean water and sanitation for their food security and hunger, they may not be able to access education or no schooling is available. There may be a lack of safe waiting facilities and native food. Healthcare is likely to be compromised by poor uptake of vaccination, limited access to poorly staffed and equipped health facilities, and also low supplies of essential medicines. Direct threat posed to health facilities and healthcare workers. The might undermine the health of children in conflict, the mental health of children and young people who are severely affected by deep rooted fear, unrelenting anxiety and exposure to violence, and undermines normal social development and psychological growth. Family members may have been injured or killed, feelings of hopelessness and lack of future, as well as witness trauma and direct psychological impact of conflict or civil unrest may lead to Post-traumatic stress disorder, there may be a continual fear of physical or sexual violence, providing even basic health care under these conditions are often extremely difficult. It requires innovative strategies adapted to particular circumstances. Climate change, rising temperature, and extreme weather patterns are likely to have direct and indirect consequences for child health. The direct effects on children are from events such as floods, mudslides, cyclones, heat waves, and wildfires. Indirect health effects are through displacement and consequences of drought and flooding affecting food security through the effects of the climate change on agriculture and ecosystem. Outbreak and emerging infections. Last 20 years have been marked increase in number of infectious disease outbreaks and emerging infections. Reasons include transmission, international travel, as well as the effect of farming, temperatures from climate change, and vector-borne diseases such as dengue, spread by Aedes mosquito species, and diseases of dengue fever has increased 30-fold over the past 50 years. Often infectious diseases outbreaks increasing chikungunya, yellow fever, and Zika virus. Ebola virus outbreaks have been associated with a high mortality, not only from the intrinsic lethality of the virus, but also difficulty in implementing infection control when healthcare services are poorly developed. These outbreaks have already highlighted the critical health dangers of the medical system, infrastructure, and the need for international collaboration prior to the most significant recent global pandemic. Cases of coronavirus as caused by SARS-CoV-2 were first discovered in Wuhan, China in December 2019. By the end of 2021, more than 125 million infections have been recorded globally, more than 3 million deaths. For poorly understood reasons, case fatality in children for this virus has been very low, although a small number, like 1 in 5,000 children, have developed serious pediatric multisystem respiratory syndrome. However, the indirect impact of the pandemic on child health across the globe is far-reaching. It has resulted in worrying loss of schooling education, increasing concern with mental health. Many children have missed immunization, experience reduced access healthcare. There may have been difficulty in on obtaining food. Many families have experienced less content from local and international trade, and travel restrictions and family life may have been adversely affected by death of family restriction of social interactions and outdoor activity have created concern about maltreatment and child development. Epidemics highlight the importance of strengthened health systems in our countries throughout the world. Human childhood number of children globally has decreased monthly over the last 30 years, yet there are still 5.2 million under 5-year-old deaths per year. Neonatal deaths are responsible for 47 of all under 5-year-old deaths as main causes of preterm birth, intrapartum neonatal conditions, infection. The main causes of postnatal mortality in children less than 5-year-old infections, pneumonia, diarrhea, and malaria, followed by injuries and nutrition contributes to mental child deaths. With overnutrition resulting in a rapidly increasing problem in many low and middle income countries. Sustainable setting the agenda for improving for the childhood until 2030. This is meditation. This time children in Kenya presented to a number has clinic with cough and diarrhea and respond to the daily managed within the upper arm circumference stressing 115 mm and weight for length more than 3 standard deviations below the median. She was referred to hospital from Christian Man's into severe acute malnutrition. In the weeks after her birth, she was moved from a area to city as her 17-year-old mother needed to find work. After Susie rescue for 3 months, the baby has been fed predominantly on Valley News flour cooked for its consistency. Her mother was troubled to maintain breastfeeding as she had 2 manual jobs and could not afford out of children. This example shows how poorly became effect in 10 years. This combination of harassment and conflicting demands between home and work coupled with isolation, leading to new urban environment and health poverty, resulting in a daughter developing severe acute malnutrition before 16 years. This is terminal women because of pro-social products, she has edema of the feet, and lower limbs and redness of the hair. One. So this is all. Thank you so much.